Hello, my name is Bill Sawicki, Managing Editor of Healthcare IT News, a HIMSS media publication. Welcome, and thank you for attending today's webinar, 3 Use Cases in Realizing AI-Driven Value for Hospital Operations, sponsored by KenSci and Microsoft. During today's webinar, our speakers will dive deep into where health systems can strike gold in today's artificial intelligence rush. Learn how they have implemented machine learning-based platforms efficiently and transformed hospital operations across leading health systems. Engage in a conversation with them to understand how you can accelerate your AI deployment process to witness tangible outcomes and ROI fast. Our panelists today are Dr. Benjamin Mansalis, Chief Information Officer at INTEGRIS Health, Tom Lawry, National Director for Artificial Intelligence, Health and Life Sciences at Microsoft, and Samir Manjure, Co-founder and CEO at KenSci. Our agenda for today, first of all, we'll be talking about what are the necessary preconditions for innovating and succeeding with AI and machine learning in healthcare. Then, what are the key AI and machine learning-driven use cases making a difference to quality and cost outcomes, followed by how do you drive change and adoption for AI and machine learning in healthcare, and then we'll end up with questions from the audience. Slide, please. So, first of all, what are the necessary preconditions for innovating and succeeding with AI and machine learning in healthcare? Artificial intelligence has been gaining a lot of attention from healthcare CIOs and other healthcare leaders, and some are even innovating with the complex set of technologies today. For example, Sutter Health, a health system based in California, has created a system that uses AI to check patients' symptoms. Sutter Health created and launched its Virtual Symptom Checker, a new artificial intelligence program to check symptoms based on severity and medical history. It reveals potential causes and next steps. Sutter Health wants to be able to manage patients whenever its patients and their families need.
Hello, this is Ben Mansalis from INTEGRIS Health. I'm one of the, I'm the Chief Information Officer of the organization and a hospitalist, and I've been leading the data science department of our organization for the past 2 years. My background includes hospital medicine, as well as about a decade before I became a physician working in data analytics and data science. So to begin with, the first question is, what are the clinical conditions for innovation? And I think one of the things that I'd say about that, as with the advent of the public cloud and the incredible tool sets that are now available that have been built around the big data questions in the consumer and retail areas and financial areas, that they're now finding applications in healthcare. And so now data scientists have tool sets that really have shifted our ability to innovate in the healthcare space in a way that we're able to do things in a remarkably new way. And I'd say that no longer is innovation about having the right servers installed and this deep technology stack, but it's really about connecting to these public cloud platforms. And so now I think that innovation is really about a mindset, and it's not about building that capability. So I think it's the can-do attitude that we have here in Oklahoma that has allowed us to be able to do things with our data science department that I think a lot of the coastal academic medical centers have been pushing the envelope, and now we're joining that fray. And we're very excited to do that. I think that that every year that passes, the technology is evolving and it's enabling new approaches. For example, because of the Microsoft stack that we've been able to take advantage of, everything from our cloud and machine learning capabilities, we've been able to introduce agile practices in our platform approaches to our data science lifecycle. So where it would take normally 6 months to release a machine learning model, working with KenSci and Microsoft's platform, we're able to turn those insights very quickly into value opportunities for our organization to capitalize on. So I think that's the big change that has made an opening for innovation to occur anywhere in the U.S. And I encourage health systems to believe in themselves that you can do this. You can take advantage of these platforms in ways that we hitherto before have never been able to in the healthcare space, and get out there and start doing some really important work for patients.
Hey everyone, this is Tom Lawry. Let me follow up on some of Bill's comments. So I am National Director for Artificial Intelligence for Health and Life Sciences for Microsoft. What that really means is I have the privilege of being a strategic advisor to health payers and providers and helping them think through and sort out how to go from talking about AI to actually making it real. I think with the comments just made, I would simply add, everyone's early in their journey, no matter how far any of you may be. But when you look in general about artificial intelligence in health, we're all early in the journey, and as things evolve, they will change. But the things I see often that make the critical difference are things like leadership. And specifically, I look at there is a difference between those who are change masters versus transformational leaders. For AI to drive value, it is going to touch every clinical operational workflow you have eventually. It has dramatic impact on how you do work. So it really is about transformation and having a leadership team in place that are ready for that. The second big thing that I see is often everyone loves talking about artificial intelligence, but if I start engaging people and talking about the status of their data estate, is far less interesting than talking about predicting things. I get asked to keynote a lot of conferences. The topic is always AI. I've never had anyone to ask to keynote around managing your data estate. So that is critical to any success moving forward with artificial intelligence. Finally, I think the precondition that's most important is how you're managing your most important strategic asset from the beginning, which is your staff and your medical staff. When you look at the value of AI coming from automating or augmenting workflow, having your clinicians and your staff, front and center for what you're doing at the beginning makes all the difference in the world when it comes to driving value. So those would be my quick thoughts.
Thank you, Tom and Dr. Mansalis. Great points. I think you covered most of the things here. I would just add a couple of things. You covered the data aspects, Tom. The ability in healthcare especially to deal with the veracity, velocity, and the variety of the data and the data maturity of the organization. Building that data maturity as we go along is an important kind of precondition, I would say, to embark on the AI ML journey. The second thing that we see often, and this is illustrated really well at INTEGRIS under the leadership of Dr. Mansalis, is it really takes a village to kind of, get this home. And everybody, whether it's the data scientists, whether it's the clinical teams, the infrastructure teams, as well as the users of the system, the caregivers, everybody has to work together hand in hand and have to be aligned towards the end goal. And that partnership is very critical to succeeding on this journey of AI ML. And, really some progressive systems like INTEGRIS have been doing a fantastic job, which are great case studies for others to follow.
Okay, thank you all for that. We'll move on to the second point. What are the key AI and machine learning driven use cases making a difference to quality and cost outcomes? With AI, healthcare leaders definitely do not want to bite off more than they can chew. CIOs, CMIOs, and other leaders need to pick the right problem to solve. They need to focus on practical matters. Take Orlando VA Medical Center in Florida, for example. It serves more than 110,000 veterans in Central Florida and had the challenge of getting patients from point A to point B within its new 1.2 million square foot lake hospital. It was experiencing many missed or late appointments simply because patients could not find their way around the large facility. So the medical center looked at juicing up location services with AI. It's a bit of a complex technology tale to tell, but the problem they were trying to fix was simple: lost patients. Now, with the new mapping and Wi-Fi tech in place for patients, Orlando VA Medical Center has boosted its patient satisfaction. Another simple example is the aforementioned virtual symptom checker at Sutter Health, a very focused problem to solve with a very focused AI implementation. So Ben, what are the key AI and machine learning driven use cases making a difference to quality and cost outcomes?
Yeah, thank you. So, at INTEGRIS, of course, we're in this process of moving to value like many other healthcare organizations. And as part of that, moving to value means understanding what are the key opportunities that we can take advantage of in order to prove things, both patient satisfaction, quality, et cetera, as well as thinking about the cost of care. Medicare is leading that, of course, by giving us guidance about our geometric length of stay and what it should be. And one of the targets that our organization has, thought about in terms of the value equation is thinking about our acute systems and how acute care systems, and how we can start thinking about making sure that the patients that we are treating are moved through our hospital system most efficiently, and that reduces their overall risk and improves access in terms of our ability of our community to get care. So working on length of stay is something that every healthcare system ought to be working on if they're not already, because that's where the incentives are, and it really aligns well with our quality initiatives. So that said, looking at how we can start redesigning our care processes and leveraging the best that our data science platforms and predictions can help us and guide us as a tool set. I'd say, from a big picture perspective, looking at overall length of stay of as a clinical system, or rolling it up into the facility or health system level, it doesn't really help people on the front lines figure out, well, what do I need to do differently today? And I think that I think a great utility in using predictions is helping inform folks in two ways. One is, what can we know today about the risks of our patients that are currently in beds, and what we could be doing differently to help facilitate their care and help them and reduce their stay in our hospital and reduce their overall risk of safety events during that hospitalization. And then, of course, what can we know about what could happen to these patients in a future state, or as they exit the hospital, will they come back to us, things like readmissions. So there's a big care redesign effort that our organization is moving towards to help us start getting the value from artificial intelligence and these tools that we're developing. So in partnership with KenSci, we started looking at our case management process and looking at things like risk of readmission, length of stay, predicting the disposition, looking at the predicted geometric length of stay, and how early in a care process can we start identifying patients that are at risk for extended length of stay, and then start doing things differently. Now, part of that is that, artificial intelligence algorithms are not really familiar to the frontline staff. Explainability and understanding how to use those predictions to change and redesign a workflow isn't something that you're going to come to these folks with, and they're not going to know exactly how to use these predictions. So working in tandem with continuous improvement and other skill sets, we can take those artificial intelligence predictions and plug them into the right care flow so that at every moment, we're iteratively looking at how we can continue to add value to the patient's care flow in the hospital and start shaving off hours, seconds even, and get people all focused from a care team perspective on the disposition of that patient and helping them move through our hospital system. And so a lot of the advantages that we have with working with integrated platforms, again, platform approach, where, yeah, we have all these challenges around data integration and making sure that all the data is flowing in the right place, but we have cloud platforms like Azure to help, to pull all that data together for us, and we can create those features. And then we have a really wonderful data visualization platform where we can move very quickly to create a view that's integrated of what's happening for those patients every day, every hour in their care and their care map to keep the team focused, the care team focused on how they can leverage those predictions effectively. And in just the very few months that we've actually been working on a particular pilot with our newest set of predictions, we've been able to address about 10% of avoidable days. And that's really, really good for about a 5 to 6 month pilot in terms of opening up access and delivering immediate value to the organization. And we expect that those opportunity days will continually be addressed as we continually refine, because we're in a platform approach right now. We can move these kinds of new features and value and constantly iterate based on these feedback cycles and improve our predictions as the care teams give us feedback. So having an operationalized artificial intelligence program in your hospital is really key to start being able to inform that care redesign so you get the predictions in the right place and that people are able to give feedback so that they can continually improve. And all about that is about getting the right kind of platform in place that you can do that work.
So this is Tom again, Microsoft. So just to add to what Ben was saying, I think quickly on the operational use case side, particularly in the United States, it's interesting to me as I work with clients around the United States where there's a lot of talk about clinical use cases, but what we're really seeing as the best starting points are more the operational financial improvement use cases. And Ben already mentioned some, such as operational throughput to do things like reduce length of stay, managing the typical risks that every acute provider has, such as predicting and preventing preventable readmissions. If I'm going to do that, I can also risk rate and prevent things like falls, hospital-acquired conditions, all of which are kind of a twofer. They are clinical quality improvement, but at the end of the day, if I can avoid a readmission, if I can avoid a hospital-acquired infection, particularly for those self-pay or fixed-pay patients, it's a huge financial gain. Looking farther down the road, we're seeing a lot of things will be coming up in the next 36 to 60 months where the IT vendors you're using now, their systems are just going to keep getting smarter. As simple as it sounds, and many times most people don't think about the value of a hospital bed, but it's the single thing that a patient has most contact with as an inpatient. I was just with one of the major bed manufacturers last week. When we start looking at envisioning what a hospital bed in the future will be, I want you to think of the robot Jarvis in the movie Iron Man. Not that it's going to be that sophisticated or have a British accent, but when we look at the capabilities of building intelligence into things like beds, MRIs, the future is really interesting. Finally, I just do a call out, and it's interesting to me, particularly again in the United States, everyone talks about population health and managing across the care continuum. I think we really need to be super focused on the application of AI outside the walls of the hospitals and our traditional thinking. And I'd end my section with just a little thing to think about. So in the time it takes for us to have this call, in the United States alone, there'll be 100,000 consumers ordering an Uber ride. How many of you use that service? And so the moment you hit the confirm, in the background, AI is taking those requests, looking at rider demand, predicting surge pricing, predicting ETA, doing the credit card fraud check before that car arrives. Once you get in that car, what do you typically do? What I typically do is, while I'm waiting, I'm on my smartphone doing things to make my life easier, more efficient. So I want you to think about all those consumers who were so used to smart, intelligent systems. Now they need a health or medical service. The same expectations they have for how they manage their life with everything else is the expectation these new consumers are going to be teeing up that you will get to meet. And if you don't meet their needs with artificial intelligence, someone else will.
Samir?
Thank you, Tom. Yeah, thank you, Tom and Dr. Mansalis. I mean, as you can see, there's like a whole range of use cases across the operational aspects, cost and utilization aspect, as well as clinical aspects. And, it's pretty much in the next decade is going to be all about predictive and prescriptive analytics in healthcare, which is going to change every single thing that we know of that happens both in the provider and the payer space. And, both the speakers earlier talked about the wonderful nature of the various use cases. What I will try to talk about is what we are seeing across the board in U.S. as well as outside. Problems are pretty common, whether you talk about throughput optimization or you talk about utilization optimization and the various use cases attached to it. What we see, successful organizations do is work backwards from the outcome. So before even thinking about AI or ML, thinking about what is the specific problem, like how Dr. Ben was with respect to length of stay, having a clear goal around what is it that we are trying to achieve with the length of stay optimization, working backwards, who are going to use it, where are they going to use it, working backwards to what models, what predictions are needed, one step backwards, thinking about what are the features needed to build those models, and going all the way to the source data, saying what are the data elements needed to build those features. So if we work backwards like that, all the way towards data from the outcomes, what happens that we have seen is the chances of success in bringing the stakeholders together is very high, and results into a much more predictable enterprise rollout and achieving all the outcomes. The second thing that we see, which is very important, is the choice of the use case in the beginning. One can choose very high-end moonshots, which, you can use deep neural nets and whatnot, and think about solving for some really moonshot scenarios. Nothing wrong with that. Given the nascent, stage of the industry when it comes to applying AI and ML, what we have seen it work really well is picking that use case which has a practical chance of succeeding, and really crawl, walk, run kind of an approach where pick a use case which you can kind of quickly roll out, as Dr. Mansalis was talking about, with respect to LOS and ED observation failures and whatnot, and get that success under the belt, have a platform approach, and then you can build multiple use cases that are very adjacent to it, because the data has already been transformed, cleaned, and is available in a way that you can kind of, go really fast and accelerate your journey for the enterprise rollout. Okay, so moving to the third topic, how do you drive change and adoption for AI and ML in healthcare? We'd love to get started with Dr. Mansalis.
Yeah, thank you, Samir. So one of the things that I think that traditional analytics has focused on, we've got a lot of guidance from a regulatory compliance perspective, from CMS about how to measure everything from value-based purchasing to HEDIS measures. One of the things that's been missing, I think, is that we've so focused on the quantitative aspects of these measurements and getting all the exclusion and exclusion criteria. We wind up with these artifacts of measurement which have a lot of value from a leadership perspective, potentially. I think that's probably, some people would criticize that. But the issue is that the time frames of those measurements from, you might have a data lag of several months, you might have a data lag of several quarters or sometimes years in terms of the measurement. And key to operationalizing any improvement is actually in a different temporal space. It's in the how am I doing today? What do I need to do differently today? And how did I do yesterday? And how do I do in comparison to my peers? It's all sort of this motivation theory about how people think differently about health, about how they can change what they're doing today. If you're not asking yourself that question about what you need to be doing differently today, then you don't have an improvement focus. And so when I think about artificial intelligence and its many uses and applications in healthcare, I really think about how it fits into the care team, where there's constraints around, hey, how you present information when you have this is what we need to, what happened yesterday, and this is personalized to you, become much more important. And surfacing the predictions in that space where people can think about, hey, have I leveraged that prediction efficiently so that I can protect the patient? Have I acted on some sort of risk profile? That becomes really the marker of the care improvement process. And I think that as we start to think about how to move insight into and operationalize it in the care teams, we have to start really thinking differently about how we present and data visualization. And again, I go back to you see the advent of all of these really wonderful visualization platforms, cloud-based like Power BI for that's the one that we use. And if it's really connected to your data science workflow, then you're able to iterate very quickly, get feedback from teams about the impact of a particular visualization, and then continually make it more based on sort of the motivation theory, make it more personal for the care team, drive competition, get people excited. We had a particular instance where we experimented with different visualizations. One of those visualizations was we wanted to improve the fall rounding in our hospital on this one floor. We had a higher incident of falls in that floor, and we know there's a lot of evidence out there that says that regular rounding on these patients that are high risk for falls, so that's our prediction. If we round on them and we do this intervention, that we're going to reduce our fall rate. But figuring out exactly how to make that personal and how to make it social. So we built this visualization and put it in the rounding room where the nurses would stand up in the morning and talk about what their care of their patient was, so what their care needed to be for the patients. And that's where they had their team meetings. So we just, as a intervention with ambient analytics, just put a data visualization there which showed a bunch of fish swimming around in an aquarium. The size of the fish was, the bigger the fish, the more adherent you were to the fall rounding on these high-risk patients. And we didn't really even explain anything about what this visualization meant. These fish are flying around the swimming pool, and the bigger ones, the ones that were more adherent. Hey, after about 2 months of just having this ambient analytics in that space about this prediction and about the adherence to this workflow or intervention, the discussion and that evolved out of hey, who's going to have the bigger fish? It was all about the fish. Interestingly enough, it also drove an incredible 15% reduction in falls on that floor over that period of time. And we didn't have any real change management going on in that floor. Keeping the excitement alive in a team and continually, we went through the holidays and we put some holiday themes into the visualization and continually refreshing these visualizations to make it socially talked about and leveraging all the really interesting things that we've learned in the retail space and in the consumer marketing space and applying them to healthcare and taking these predictions and turning them into something that really can be meaningful to the care teams has been really transformative in being able to drive improved outcomes. And I think that having a pipeline or a platform where you can quickly move to these visualizations, like a cloud-based one like that we use to, we can make it build it on mobile, we can build it in the web, we can put it on a monitor anywhere, we can put it on screensavers. It just really builds the engagement, and we can wrap change management into a scalable campaign across our whole system, and we're taking steps now to move that visualization across the system and build up this ambient analytics platform and socially engineered analytics framework to really drive the change management in a totally different way. And that's what these platform approaches, where you can go from data ingestion and engineering perspective and Azure, and move it all the way to visualization through our partnership with KenSci to get the risk and the AI done to find these patients that are higher risk and set up the intervention, and then push it really quickly to a platform that we can show people and get their comments on and get them excited and be able to deliver it in mobile and that multi-channel format, really taking advantage of all the knowledge that we have in marketing to get these improvement paradigms part of our regular culture.
Yeah. Thank you, Dr. Mansalis. What a wonderful story. Sorry, go ahead, Tom.
No, you go ahead, Samir, please.
Dr. Mansalis, what a wonderful story about the gamification with the aquarium and fish. Super interesting. We have been on this journey now for many years, and coming from a technical background where, sometimes you focus on building the best algorithm and, the highest accuracy and precision. As we looked at various health systems in U.S. as well as outside, it has been mind-boggling, the learning around the workflow nuances and how important it is to understand how to drive that change with the end users, especially in this space, given how motivated and mission-oriented the physicians and nurses and everybody is, and they're so overworked. So introducing things in a way that they can consume naturally in their workflow is paramount to being able to succeed in the AI/ML journey. And I'll give you one example. Very early on, we were working with an organization which had built this tool literally 23 years ago for triaging the huddle tool in the morning, and they just loved it. They were used to it for decades, and they just loved it. And they said, "This is great, the stratification that you are showing, but we are not ready to let go of this tool." And, we built an integration back into the same tool so that their processes and the way they do the triage in the morning did not change at all. But they were able to get the stratified list and, the benefit of the AI/ML in the background without even knowing that they're consuming it. So the beauty of really, to get that change and to get the adoption of AI/ML, one of the core principles, in our opinion, is to be able to inject those insights into the workflow without even sometimes the user knowing that they're consuming something really sophisticated in the back end. The second thing that we have learned on our journey is the whole nature of explainability in AI and building trust with the end user. The reason why a doctor or a physician, even if they disagree with each other on a certain topic, the reason why they respect and trust each other is because they can interrogate each other, have a dialogue. When a machine is providing insight, and if it is not, if a person cannot interrogate it, cannot understand the explainability associated with that prediction, what are the factors that are causing the machine to provide that recommendation, then it is very hard to get that adoption and the same trust that you have from a human being to human being. And so I would say those are the two main factors that we see as the key catalysts and drivers in driving adoption. One is the deep understanding of the workflow and meeting the end users where they are in their journey. And the second is really creating that trust through explainability of AI presented to them in the workflow in a way that they can understand the predictions.
Great summary, Samir. So I would just quickly add to that when it comes to the question of how do you drive, and I would say lasting change and adoption. I'm reminded of a quote from Dr. Edward Deming, the father of CQI, which is, "There is no instant pudding." I have the opportunity to work with a lot of organizations in the United States and around the world, and many start out with great enthusiasm, and then they get stuck in the POC and pilot phase. And invariably, when that happens, I see certain things that frankly had not happened, and Samir had alluded to some of them. The first thing I always suggest doing for an organization, this is a leadership issue, is what I call an AI reality check, touching on a number of the things that Samir already mentioned. And to me, that reality check is a close look at, first of all, the people side of the equation. So the value prop for any type of artificial intelligence, basically, and especially machine learning, comes down to its ability to either automate work processes or augment them, which is to say it's all about changing how people work. So in that regard, I always ask the question of, do you have your HR people at the table as you're planning your enterprise-wide AI plan? And interestingly, most of the time, HR is an afterthought. Then it comes to the data, which I already mentioned, where everyone's talking and writing about data as the new currency in healthcare. And if you believe that, my simple question is, are you managing your data in the same way you're managing your financial assets? I'm sure that if I went to your board, you would have a committee managing all financial assets, and you have auditors. Are you treating your data the same way? Because that's key. Someone already mentioned it, nix the moonshots. People get excited, and they decide they're going to have moonshots. Start with well-curated, fast time to value pilots that demonstrate to everyone you can do it. And then other things, and I think they've been touched on, even if you're doing all of this, and you're starting to spin up enterprise-wide machine learning that's being deployed, we see times where people are spinning up and deploying algorithms that have high correlational value that matter on quality and efficiencies, that no one stress tests for things like bias, transparency. So let's say we've spun up an algorithm on best treatment options for something, and the results are that it's truly improving the overall quality and outcome of what you're trying to predict with your patients. So the overall average is good, but if I were to say it's improved quality and improved cost effectiveness, but the dirty little secret is it has 3 times the ability on predictive values for white males versus Hispanic females, even though it's driving value, would that be okay? So it's things like that that we often see people starting the journey and not fully understanding the complexities. And then finally, on making it last and making it real, the big thing that I often see is leaders not thinking differently. And this truly gives us the opportunity to rethink how we do things. For those of you who have already read the book, great, but one of my most favorite books that I came across recently is called Blue Ocean Strategy. And essentially, it's describing the model that we're seeing play out on digital transformation in every other industry, where with digital and data, there are new entrants to the market that basically are decimating traditional ways of doing work by going in, defining processes, making them much more efficient for the consumer at a much lower price point. We see this starting to happen. I believe the competitors going forward for most big provider organizations are not the ones you traditionally think about, but rather others who are using AI, taking a blue ocean strategy and really blowing it out in ways that consumers are going to be very interested in participating in what they're doing.
All right. Well, thank you to our 3 panelists for their wonderful insight. And I do want to apologize to the audience for our audio issues earlier, but we will get into some audience questions. So I want to first remind everyone that you can continue to submit questions using the Ask a Question panel on your screen. So we have a couple questions in here already for any of our panelists. What are some best practices to gather stakeholder buy-in during the planning stages of AI implementation?
Well, this is Tom. I can maybe start the volley. There are many things. First of all, great question. Most of the time, what I see, if there's going to be a sticking point in that area, it relates to engagement of your clinical leaders. And so there was one organization here in the United States that I thought did a great job where they started having a very strong push for an enterprise-wide AI program up to the CEO. They've got a board committee. They task for all the clinical use cases, the accountability to the chief medical officer. Anyway, in short, they had 1,000 ideas. They actually put together something where they brought together 30 other top clinical section leaders, and they did a one-day program before they did much of anything to first educate on the basics of AI. Second, within that framework, they did a brainstorming to get best ideas from all of their clinical leaders. And from that, they came up with like 40 ideas in one afternoon. And then there was a set of filters and a screening criteria where a subset of those doctors really took those ideas and got it down to 4 specific ideas, of which the CTO and others were heavily involved in creating the criteria for initial use cases. Based on that, that's how they picked their first use cases. That's how they engaged, frankly, organizations like KenSci once they had a handle on it. But more than anything, the importance of that was every clinical leader from the beginning felt like they had their hands on the steering wheel.
Yeah, I could chime in too about how do you build the momentum and the organizational buy-in? It's a challenge, and I think to point some of Tom's comments earlier, which is that first is a bit of education around that anything that we do with artificial intelligence is going to ultimately, the value extraction component of it lies in the hands of motivating care teams to do something different and helping people understand that it's not an easy button. It's helping the organization understand that part of this work in leveraging AI is actually redesigning care processes and the things that people do to deliver better care. And AI can be a component of it. Analytics can be a component of it to help make more visible what needs to be done. And part of that means getting people to understand and getting very deep in their problem set. I think that we all want to believe that we can just install a tool and that it will all get better. Tools are only, a tool in the hands of someone who doesn't understand their problems still won't achieve anything. And getting deep into that problem and understanding and evolving continuous improvement methodologies as part of the care redesign process and getting the tool baked into a care process is, I think, really, really critical, and making sure that leveraging that tool and its adoption is part of the executive sort of report out as to, hey, have we leveraged this? Is it being used? Are people looking at it? Is it part of our care our process? And what is the adoption rate of that process? And really thinking of AI as a component in a chain of changes that need to be made in an organization in order to be successful. So that education piece, and then getting the clinical leadership behind it, and all of those people from the executive at the executive level to say, hey, this is an important problem, this is impacting our patients, and then I think the caregivers will wrap themselves around those ideas to make sure that they can get the value for the patients that are being cared for by the system.
Great. Samir, did you have anything to add to that one?
No, I think both Tom and Dr. Mansalis covered everything. Being grounded and really understanding pragmatically what has failed in the past, what is the definition of success, and bringing the team together around it is the most important component. So very well said there, Dr. Mansalis.
Great. The next question here, how might the application of behavioral science and economics help close the gap between algorithm creating and widespread adoption?
That's a really good question, and I'm humbled by it to a degree, to be honest. I think that the behavioral component, I think the University of Pennsylvania has been doing some components of this around, I mentioned a little bit about socially engineered analytics, really thinking about leveraging sort of team dynamics and visualization and kind of marketing principles to drive adoption. And I think as people begin to understand and personalize, hey, when you, I'll give you a for instance around this. So the impact of, let's say, a prediction around fall risks, right? So we know we have a fall, it costs this amount of money. There's a huge economic impact to the system, but it's not just the system, it's also, we're a community organization, it impacts when a patient falls in our organization, that's a patient that's staying in a bed longer, it's a patient that has additional harm to them, there might be additional costs associated with their care, and that also impacts access, right? So if we don't have the resources, if we are spending resources on harm and taking care of patients that have fallen in our institution, and it's less investment that we can have in the community in taking care of those additional patients that are coming in. So as we think about the arguments around the economics of how that impacts the care that we can deliver to the community, as well as, hey, how do we tell this story and translate that into something that the care teams can understand and make it impactful to get them bought in to adopting a particular tool. So one way that we've done that before is we, in all of our socially engineered analytics that we put out there for ambient analytics, we always include a patient impact or a value impact analytic as part of it. So for example, we did a neonatal sepsis calculator visualization that we displayed to care teams. And on a daily basis, we would be able to say in the past 7 days, this is the number of needle sticks that were avoided. Babies getting stuck with needles is not a popular thing, right? It's bad for babies, and babies don't like it, and people can identify. And care teams really love that. They wanted to get their needle sticks down, right? They did not want to be sticking with babies. And it also had a subsequent, inappropriate NICU stay value, inappropriate antibiotics. So as we translated this stuff into something that care teams could wrap their heads around, hey, if I do something different today, this means something for my patients that are in beds. And that could be very, very dramatic in helping drive adoption.
Hey, this is Tom again, Microsoft. I would just quickly add that in my view, when it comes to developing an enterprise-wide AI plan that actually works, the number one thing is in your planning, what are you doing where with your culture, you're either going to divide or empower your workforce, at least how they feel. And I think there's so many things that often get mixed early on in that regard.
Yeah, I think just adding on to what Dr. Mansalis and Tom said, having an enterprise roadmap and starting that roadmap with a crawl, walk, run approach where you pick the first use case which has a higher chance of success helps kind of build momentum in the organization. When you see success on some of those and you see the impact, whether it is economic impact, ROI, or whether it is directly an impact associated with patient outcomes, that kind of fuels the enthusiasm to take on additional use cases. And so just thinking about that sequencing for the next 3 to 5 years and starting small, getting success, and then building on top of it, I would say is the best way to bridge that gap between algorithm and adoption.
All right, thank you all. The next question here, this viewer says, I think there is a poor understanding of what machine learning AI is and the potential it presents. So they're wondering, what is a good way of educating the organization about how this technology will transform information-based services like healthcare?
I can take this. When we started this journey 4 years ago, when we were talking to even C-level officers in healthcare organizations, the discussion was a lot around the why machine learning, why AI. That entire discussion has shifted from why to how. And one of the things that we have found very useful is really creating that awareness of machine learning and applications of it to healthcare through workshops and through really bringing the clinical stakeholders, the tech folks, the infrastructure folks, everybody together in a room, along with folks from Microsoft Cloud teams and other places, in a way that basically we can take a look at the business problem, we can take a look at the infrastructure, we can take a look at the machine learning associated with it, and really bring that entire room together to kind of solve for that common outcome that everybody is seeking. And designing that workshop, designing that 4-hour session in a way that helps the end users and brings everybody together is paramount in getting that understanding. But would love to understand if Tom and Dr. Mansalis have seen.
Yeah, well, let me jump in. And first of all, again, another fantastically great question. We could easily spend an hour just addressing what is AI. So if you go out to any search engine, I just went out to Google the other day and typed in what is AI, 4.3 billion results. So there is no one universal definition. It's kind of one thing in many things. Oftentimes, if people are talking about AI, particularly in health, 9 out of 10 times what they're really talking about is I want to predict something, which is machine learning. And a lot of times, whether it's you or the people you're representing as your important internal constituents, you don't have to be an AI expert, you don't have to be a data scientist, but understanding the fundamentals are super important. Many times when we're working with C-suite leaders and others to educate them, we go through little exercises to say they don't need to know what an algorithm is, but if we go through a process of saying, in your role, what are the 3 things where if you could predict would make you, your team, or the organization better? And it's getting them to think through how this stuff will help them improve things they care about. But it's a great question, and many times people are talking and they get to the end of the conversation and they're really not sure if they're talking about the same thing when it comes to AI or ML.
All right. Thank you both very much. And this next question here is also kind of about educating your organization. How do you show the return on investment of AI initiative to your board or decision makers to fund the initiative?
Samir, do you want to start with that one, or do you want me to start?
Yeah, go ahead, Tom, please.
Well, so again, awesome question, and that's where I always recommend if you're early in the journey, you're starting not with the big brilliant ideas that kind of represent these huge things, but rather well curated use cases that have what I would call rapid time to value. So, and I know Samir and his team do this all the time, but it's finding things like I could go out for any of your hospitals in America. I could look up your readmission rate. I could look up your hospital-acquired infections. If you're in the bottom quartile and you're actually being penalized for readmissions where you're losing, some percentage of all Medicare revenue, and I can go in and say, what if through machine learning, I can get you out of the doghouse, improve your readmission rates, and gain back, say, 3% of Medicare revenues within a year? That would probably get the attention of the CFO. But there are many things, or another one that I think is really particularly interesting in America is denials, where if I can go into your chief revenue officer, your CFO, and say, what if I could reduce your denials by 20%, knowing that, one, that's a good number, 2, chances are the CFO probably in the performance review at the end of the year, one of the metrics is days in outstanding receivables. And all of a sudden, if he's looking at or she's looking at, gee, it's going to help me get a better performance appraisal. There are a number of things that are very specific And particularly early on, starting with those rapid time to value and having a measure that everyone in the C-suite is going to care about is a great way to start.
Yeah, I mean, just adding on to that quickly, the fundamental notion we have around that is if you can predict, you can potentially prevent, right? And you can apply this to hospital ops, like how Dr. Mansalis and team are doing, whether, it's with respect to length of stay, predicting overstays, and, being able to, once you can predict those things, whether it's, overstays, whether it's, ED observation failures, whether it's left without being seen in the emergency department and so on, you can even if you can predict, doesn't mean you can always prevent, but you can potentially look at what is the potential possibilities of preventing those events and being able to then, see the economic benefit of that and ROI attached to that. And it's just like, like anything else in life, you start with something, you get better at it. It gets easier and easier to roll out more and more other use cases which are adjacent to that. So the cumulative effect of that quickly starts adding up because, the care continuum is like a very interconnected mesh of so many different interaction variables. So being able to isolate those and being able to focus on specific problems, solving for those, and then taking the same learning, same platform approach to solve adjacent problems is how you're going to get a huge ROI in a very practical manner. That's the way we have seen things work, and most of the successful organizations are adopting a similar approach, like how Dr. Mansalis was talking about.
I'll add. I think those are really great comments, and I want to say, hey, AI it's math, right? So statistics, like these are things that we're, I don't know, I feel like the conversation's moved away from it, from the sort of like, hey, we've been actually using statistical approaches to look at things like net present value and return on investment for quite some time. And I think that one of the things that we have to, I think that I've experienced, at least in my organization, is that, a lot of the ROI assessments that you can look at that, various organizations or consulting companies might bring to you in your health system, they might be, working on a set of assumptions, right? And those assumptions or the applicability of those assumptions are a place where you have to start thinking whether those things are true for your system or not. I like to go back to sort of the IHI sort of framework of like, if you haven't written down your process, you probably don't have one. And a lot of the predictions that the value opportunity that you're going to get out of utilizing a prediction is based on embedding that in a process. And as depending on what the state of your care processes in your organization, you might not actually have any of them written down, or maybe you have some of them written down and thinking about how to, the system is designed to produce the results it does. And I think that one of the things that we could say about looking at an ROI assessment is that you might have a lot of work, not just in rolling out a tool, but actually in defining the current state and a process, and then actually then thinking about what it would take to leverage it based on the assumptions that you're making in your ROI case. So I think that, again, if I get back down to basics here, it's like, what is your current process, and are the assumptions real, and are the statistical methods that the AI platform that you're looking at what kinds of assumptions are they making? Is there a crosswalk, and will your system achieve the value and achieve the sustainable value of that improvement, right? So maybe an ROI tool for AI will only be useful in a complete care redesign, and you might achieve that ROI in a 2-year time frame, and there would not be ongoing or continuing ROI from that tool. So it's some things that to think about as you explore whether to use these kinds of tools in your care processes.
All right. Well, at this time, we will wrap up, but I do want to say thank you to Ben, Tom, and Samir for such a wonderful presentation. I'd like to invite our audience to complete the evaluation at the conclusion of today's event, and please share your thoughts with us. And also, as a reminder, today's session will be available on demand for 1 year through the HIMSS Learning Center. So have a great day, everybody. Thank you.
Thank you, Bridget.
Thank you so much.